We are now in the doc zone. This time of year, school sports are back in play, and many people are taking their activities back outside with the cooler weather here. But it could be a recipe for injury. Today, Dr. Shelden Martin and Dr. David Ott from OrthoArizona join us to talk about shoulder injuries. Dr. Ott, let's go ahead and talk about what are some of the common shoulder problems you see in adults.
A very common injury or condition that we see is what's called frozen shoulder. And it happens to middle-aged females for no reason. Sometimes there's an injury, but most often they just say, my shoulder began hurting, it got stiff, and it can be very, very painful, and they lose motion. We don't know the cause, but it needs to be addressed. In males, a lot of times I'll see them come in and they say, I can't lift my arm up, and they were at the airport and they pulled their luggage off the carousel and they felt it pop, and they said, oh, I think I'll get better, but a month later they're still in and they can't lift their arm up, and that's a classic condition of a rotator cuff tear.
So, Dr. Martin, let's talk about athletes. What are some of the common problems that you would see?
Sure. One of the more common things that I see in athletes is a shoulder separation, and I can show you on this model here. This is essentially when an athlete, for instance, goes down hard onto the field and hits their shoulder, or if a hockey player gets checked into the boards very forcefully, it can separate this joint between the clavicle or the collarbone and this part of the scapula bone, and that can separate this joint. I can also see, a lot of times I'll see shoulder dislocation injuries where the ball of the shoulder joint gets dislocated off the socket. I see lots of tendon injuries, biceps tendon, and rotator cuff injuries as well.
So you both see these types of injuries. So when is it appropriate for someone to come in to see specialists like you two? Sometimes they might be scared or they wait too long, and at that point, surgery is then what they're looking at.
Well, the rotator cuff injury, the guy who hurt his shoulder lifting something, that should be addressed quickly. The problem we see is that they think it's going to get better, because it does get a lot better initially. But after 2 or 3 weeks, when they still have weakness, they can't lift their arm up without a lot of pain, they need to come in. The lady who's still having difficulty trying to get her clothes on and get her arms into the sweater, the sooner they come in, the faster we can get that addressed.
And I think in athletes, first of all, it's important to define what is an athlete. And so I think there's a wide spectrum there, from the weekend warrior to the person who occasionally goes to the gym once every 2 weeks to the professional athlete. And that's a pretty large spectrum. But I think for the average person, the weekend warrior, the person that goes to the gym, if they're having a little ache and pain after a heavy workout, that's to be expected and that's normal. That's going to get better after a few days, a little ice, a little rest. But if your symptoms are persisting, then I think it's definitely time to come on in and get checked out.
So let's talk about treatment options. What are some of the things that you guys recommend for your patients, depending on what the problem is?
Well, we are surgeons and we make our living doing surgery, but the vast majority of what we do for shoulder injuries is not surgical. Cortisone injections, physical therapy, just an explanation of the problem is oftentimes all we need. There are times when we have to fix certain lesions, and Shelden, talk about some of them.
Yeah, so traditionally, historically, most of our surgical options were through open incisions, and now we do more of these procedures arthroscopically, where we make little poke hole incisions around the shoulder, put a camera into the joint or the space above the rotator cuff, and put our instruments in through these tiny incisions and do the surgery through just these little incisions. And so we've gotten much better at doing that over the last 10 and 20 years.
So what would be the recovery process for some of these patients?
After the arthroscopic procedures, recovery is a lot quicker than the traditional open procedures. They're painful, I have to admit to that, but most of these folks will go to physical therapy. There's specific restrictions we'll put upon them, but they will be able to start their motion fairly early, and once healing is moved along with physical therapy, we'll see after 6, 8, 12 weeks that they'll get active motion and very good strength.
All right. Well, I'd like to thank the doctors from OrthoArizona for being with us in the Doc Zone.